Welcome back. That was Dr. Leis, an introduction done by Chloe of Dr. Leis when she visited him a couple weekends ago. Dr. Leis, let's bring you in here, and there you go. And how are you this evening? Thank you for joining us.
Hi, Kristy. Nice to be here.
You're the director and medical director and chief surgeon for the Transgender Center in Pennsylvania.
We call it the Philadelphia Center for Transgender Surgery.
Well, I appreciate you joining us tonight. I'm sure there's a lot of girls that could call and have a lot of questions for you. One of the subjects we'd like to talk tonight about is we've heard some things recently about injection parties and silicone injection parties, and I wanted to talk about the negative effects of silicone in the human body when it's administered or when it's injected improperly or by the wrong people.
Well, where can we start? I can give you a little history on this.
Sure.
In the 1950s and 60s, the United States government, through the FDA, licensed on a temporary basis a group of 15 surgeons and dermatologists to test liquid silicone. And we're talking about medical grade liquid silicone because there are a lot of industrial uses for silicone, and this is one of the problems because people are using industrial grade silicone. They don't know that they're getting that instead of medical grade. Well, for about 15 years, these doctors used it for cosmetic reasons, mainly to fill in wrinkles, frown lines, smile lines, acne pits, all these small defects. But after 15 years, when they submitted their data, there were so many problems and complications with it and poor results that the FDA never approved it for general use by doctors. In the 1962, silicone gel breast implants came on the market by Dr. Cronin and Guerra were the first doctors to use this and develop it with the Dow Corning Corporation. And they were located in Texas, and they introduced it to the plastic surgery world. And doctors around the world started putting in silicone gel implants. There were some problems associated with it. The main problem being about half of the people that got silicone gel implants developed abnormally round and hard breasts. And after a while, there were so many problems associated with it, people started complaining and people started thinking that they got diseases from it, which really wasn't true. But in 1992, because of all the scare reports that were out there, and especially following Connie Chung's television interview where she blasted silicone gel implants as causing all kinds of diseases, and of course she said this without any scientific background, the FDA took silicone gel implants off the market, and doctors weren't allowed to use silicone gel at all. And mind you, the injections of liquid silicone gel were never approved for general use by the FDA. But now they temporarily again approved silicone gel implants, and now they're off the market also. So for the next 15 years or so, many studies were done on silicone gel breast implants. And in 2006, they came back on the market in an improved form, and after all the studies were done, they proved beyond any question of doubt that no diseases were caused by silicone gel implants, even ruptured silicone gel implants. Still keep in mind, the liquid injections were never approved. Now we do use silicone gel implants, but they're called cohesive gel implants, and we could devote a whole evening to just talking about breast augmentation, which maybe we'll do in the future, or unless someone has a burning question, we can go over that because they're very good. However, they're not liquid silicone, and they're always encased in an envelope. So they're implanted as an implant. They're already pre-filled. There's no liquid involved. As a matter of fact, even if you cut them in half and hold them up like two halves of grapefruits, nothing drips out. There's no leak at all. So there are some liquid silicone products that are used in certain limited medical situations, such as for retinal detachment, which are approved by the FDA. They're still not approved by the FDA for injection into or under the skin. And when they are, some doctors use it as an off-label product. It's not illegal for a doctor to inject it, but it's used in very limited cases. Some doctors use liquid silicone in very tiny, that's the key, very tiny amounts in the skin, in little wrinkles. You're only supposed to inject 0.01 or 0.02 cc's at a time, and you're supposed to leave a little space, 2 to 4 millimeters, about an eighth of an inch, between those little tiny micro droplets. If they're to be used at all, that's how they should be used. The problem is, as you know, and as you just mentioned, we have pumping parties in our community, and people who, most of whom aren't doctors at all, they're self-styled experts in silicone, and God knows where they get their silicone from. I would think that in most cases they're industrial grade silicone, and they inject them and charge a certain amount of money, a few $100 into each area, and people put them in their faces, in their lips, in their breasts, in their butt, in their thighs, hips. The problem is, it's not meant for that, and certainly industrial grade silicone isn't meant for that, and it certainly is someone who's not even medically related with no medical training at all shouldn't be doing it. So what's the problem? The problem is that the body forms in lumps which can get large, like a large rock, like 2-3 inch lumps, and not only look and feel hard, but can get painful. And the body develops a foreign body reaction to this foreign material, especially if it's not medical grade, and the body tries to get rid of it. Now, I know some people have injections, and sometimes 5-10 years later, they still haven't had a problem with it. But frequently, sometimes it's a matter of weeks, in a matter of months, or sometimes not for years, the granulomas, these inflammatory processes, get worse and worse, and they eventually can be so bad that it doesn't really get infected, but it almost acts as an infection. They get red and painful, and actually the body tries to get rid of it, so it breaks through the skin.
Ow.
And it causes big ulcers in the skin. I can tell you, I've been in practice about 35 years, and I have had, unfortunately, many times had to remove large pieces of the cheek or the lip or the breast or the thigh or the buttock in large operations to get rid of these large ulcerating tumors that are draining and painful. So it's really a terrible thing to do. And if we get nothing else across tonight, I hope we can convince some people that this is really a dangerous thing to do. It's not only illegal, but it's just dangerous. And that's why it's illegal. You know, the medical community and the FDA doesn't disprove things for no reason at all. They've not cleared them because they've caused a lot of problems, even in very tiny amounts, let alone in huge volumes, hundreds of cc's put in one location at a time. So it's terrible. I've had to do all kinds of surgery to get rid of these. So I would just tell people, please, please do yourself and your friends a favor. Don't go to pumping parties. Don't let anyone put silicone in your body. If it's going to go in your body, have it done by a licensed dermatologist or a plastic surgeon. And even if it's going to be put in off-label, it has to be put in micro droplets, not enough to augment your cheek or your breast or your butt or your thighs. There's an additional problem with the breasts. The breasts are an especially dangerous area to augment with liquid silicone. And that is, we all know that breast cancer is very common.
Yes.
8 or 9 out of every 10 women in the United States gets breast cancer.
That's not a statistics we like to hear.
Trans girls develop breasts from, number one, from hormones. You can get most girls get an A cup or an estrogen. And sometimes you can get a B or a C cup. Occasionally a D cup, but that's rare. So a lot of girls put in the implants instead. But if you inject liquid silicone into your breast, there's something that happens which is very dangerous. That liquid silicone frequently undergoes microcalcifications. Little calcifications form in the breasts, around the silicone injections, it happens that these little calcifications are also on a mammogram signs of breast cancer.
So it gives
confuse
a
the
false positive.
diagnosis with breast cancer, and the only way you can tell is to do a biopsy. You have to take out a piece of that tumor or all of it and biopsy it, look at it under a microscope by a pathologist to know whether it's cancer or not. So it's very dangerous. It doesn't cause cancer. It causes other problems, but it can confuse the diagnosis with breast cancer. So that's a big reason never to put a liquid silicone injection in your breast.
What do you think is the biggest draw to these pumping parties? Is it just instant gratification thing? Is it just a lack of information or a lack of education that draws women to these parties?
Certainly, it's a lack of education on everybody's part who goes to the party and on the person that puts it in. The person that puts it in, the pumper, puts it in because they're making money. They're making some bucks. The people that go there to do it go there because it's a cheap way to get a breast augmentation or a bigger butt or a bigger thigh or bigger lips or bigger cheeks. It's a cheap way, but it's a dangerous way. That's what I want to, the message I want to give tonight.
I do too.
Dangerous way to do it.
I spent some time this afternoon Googling around and doing some Craigslist searches in some major cities and just put in the word pumping party or anything like that. And I was amazed at how many hits came up and how many people were doing this and how blatant they are in their advertising and drawing people in. It's not like it's a commercial advertisement. It's kind of stealth. But it is there, and they're advertising on the internet where to get this stuff done, and it's scary.
Yes, I read recently in some of my recent research on silicone that there's about a 30% increase in the amount of illegal injections of liquid silicone to augment the hips and thighs in the past year from 2008 to 2009, the last year that they have good statistics on it. 30% increase in 1 year. Very dangerous. People are getting sucked in by these advertisements and by people that want to do pumping parties in the trans communities around the country. But it's really dangerous. I mean, there's some people I know, some trans people are so desperate to want to look feminine and to transition that they'll do anything to get a quick fix and feel good about themselves. And, well, they don't care about what happens. Even if someone said, well, you could have a problem with that. They say, well, I don't care. I just want to do it now, and they'll go maybe have a couple of drinks and go do it. But it's really dangerous, and it's really foolish in the long run because you're creating danger for yourself. There's a good chance you'll need surgery sometime in the future, which will leave larger scars when you have to remove these big sections of hard rock-like formations under your skin and big ulcers in your skin. But also in the long run, you may wind up paying more money. So in the long run, you don't save money at all.
It's amazing, and I appreciate your insight and your expertise on that subject.